Sawadi, my name is Wanason Nupapongsi. You can call me Yui. I am the member of YKPs Laos. When I was a teenager until now, I have the experience to work with students and youth in many areas. Because I was a volunteer when I 15 years old and I joined the FEM youth group in Laos. It's just like the youth group that youth could join and participate to do the activities in each other for 5 years, and then I had a good opportunity to be the real members on that generation and work with other organizations such as Save the Students, International Laos, Child Fund Laos, and also YKPs Laos. I also have the experience to work on the child rights and have some trainings about HRH by train them on the grammar show, life skill, basic of TOT for students and youth. At the same time, I have a good chance to be the member for YKPs Laos, and I did the activity to support the youth in Vientiane by trainings to them too. The government of Laos PDR continues its political commitment towards improved health outcomes. It supports, promotes, and carries out its rule under the Declarations of Commitment at United Nations General Assembly Special Sections on AIDS in 2001 to support the multi-sectoral response, the MDG 6. Means combat HIV and AIDS, malaria, and other diseases. And 3 zero strategy. The first one, zero new HIV infections, zero discriminations, and the last one, zero AIDS-related death. On the 2010 Law on HIV and AIDS Control and Prevention, hereafter referred to as the HIV Law, and on 2011 Political Declarations on HIV and AIDS, we have to develop the National Strategy and Action Plan for HIV and AIDS and STI Prevention and Control on 2016-2020, which will better lay out a more focused and result-driven response in combating HIV and AIDS. Moving forward, the country supports the global movement to embark on fast-track strategy to end AIDS epidemic by 2013. Third, rapid scale up of HIV program. It will enable to outpace the epidemic by 2013. The strategy is to achieve a target of 90% for treatment. The first, 90% of people living with HIV knowing their status. Second, 90% who know their status are receiving treatment. And the last one, 90% of those on treatment having a suppressed viral load by 2020, and further increase this to 95% by 2030. The overall HIV prevalence in the general population aged 15 to 49 years old of Laos PDR remain low as 0.3% in 2015, but saw an increasing trend from 0.16% in 2003 to 0.3% in 2015 based on ASEAN epidemic modeling and spectrum data. The number of people living with HIV was estimated at 11,958 in 2015. HIV incidence is estimated to be between 800 to 1,000 cases per year. The 2014 IBS showed that the highest prevalence of HIV was found in key affects population gap, namely men who have sex with men (MSM) 1.6% and sex worker 1.4%. The issues of young key population group. The first one, the people living with HIV, there is the issue to access the health service. For example, the stigma issue, they don't have self-confidence to take them into the process of treatment in the public service. And the last one, for MSM group, they don't have enough stable form community because sometimes the community will reject them by discriminations. As my view, I have 5 points to improve the issue of YKP. The first one, improve quality of counseling using comprehension prevention. Second, strengthen the capacity building to use group network volunteer. The third one, support the youth volunteer on the community by providing HIV prevention and peer educations. The fourth one, focus on strengthening and building management and planning capacity building. And the last one, improve access to quality preventions, behavior change communications, and provisions of condom to specific vulnerable group of people, ethnic group, youth, migrant worker, sex worker, MSM and TG. I think this information it will be good for you. Thank you very much. Bye bye.